the vestibular system essentially is like a series of spirit levels inside your ears, and they tell you which way up you are. So every time your head is rotating, every time it's moving, it's going up and down, side to side. The vestibular system has little sensors that say, hey, we're moving. This is which way we're moving. And it basically tells you in relation to your head. And then your brain has a process of connecting your head to your body, and that is your proprioceptive system, which we'll talk about next. So your brain figures out which way your head's moving. Because the proprioceptive system already knows what position your body's in, it gives it a kind of final total picture of what you look like in space. And the vestibular system is sort of interesting. So in athletes, you always assume vestibular function is going to be pretty high because you're in a game, your head is turning all the time. You're, again, moving forwards, backwards, up and down. Your vestibular system is getting more of a workout than most non-athletic individuals. But it's also a bit of a weird one in that we see as people age, vestibular function seems to go down no matter what. Like even the super athletic people, their I can't say the word now, their vestibular system starts to degrade over time anyway. Maybe it goes a little bit slower, but it still seems to happen. And when it comes to sports, there's a couple of risk factors of things that can make that happen quite a bit quicker. And one of them is kind of falling. So if you're falling and hitting the ground an awful lot, then that is going to activate the vestibular system a whole lot. But sometimes, again, if you're engaging in lots of non-controlled falling, so falls where you weren't expecting it to happen, if that's then accompanied with like pain and injury and stuff like that, sometimes that can kind of overstimulate the vestibular system. It becomes hyper aroused. It starts to become afraid of falling, and that can cause problems. If the fall itself results in any kind of whiplash, then that can cause more degradation of the vestibular system. And then the other thing is any kind of trauma to the head, which again, in a sport where your head is used pretty often, we might find that although we're giving it quite a bit of a workout, there are plenty of instances where our vestibular system is going to drop down, at least for a short period of time. And what happens when the vestibular system function declines or becomes hyperactive, or it's just not functioning the way that our brain would like it to when we're doing difficult tasks? The brain kind of says, okay, no worries. We have 3 vestibular canals on one side, 3 vestibular canals on the other side. If one gets weak, so let's say one of the vestibular canals on my left side gets a bit weaker, it's not responding as quickly, the brain says, okay, cool, let's just stop listening to that one, and we'll use information from the right side to help decide what's going on the left side. And over time, maybe the right side starts to decline as well. Well, because the vestibular system's dealing with balance, and we have eyes open all the time, and eyes are actually really good at helping us deal with balance, then over time, the vestibular system might say, okay, let's ignore both of those sides, and let's just say every time we see the world go vroom, like that, that's going to be a signal that we're moving to the left. That's going to be a signal that we're moving to the right. So although we are working out our vestibular systems pretty hard, it's pretty common, especially in footballers, to find a vestibular system that is maybe not functioning as well as you might expect for the degree of athleticism that person has. How would you know that is the case? What I would recommend you do, close your eyes. Well, test your balance, like stand on one foot, test out your balance, close your eyes, and see how much of a difference is there between eyes open and eyes closed balance. For somebody who's pretty physically fit, there should be a very, very small difference between balance with your eyes open and balance with your eyes closed. So the more kind of strength you have in your body, it should be pretty easy to close your eyes and not need to rely on that visual information. Your balance will get a little bit worse, but if your ankle is steady, it's not kind of shaking around with your eyes open, then you close your eyes, your ankle should be steady. You shouldn't have too many sways and twists. You might find like, ooh, and then re-steady yourself. But you should get better over practice. It shouldn't be too difficult in the long term. If you close your eyes and your balance is going haywire, then that's a pretty strong sign that we could do with some work on the vestibular system. And then the other way that we can do it, if you wanted to kind of bulletproof this a little bit, with your eyes open and with your eyes closed, practice moving your head around. So when we start challenging the vestibular system, then see, can you actually keep your balance? So head moving with your eyes open, it's going to get way worse. Your balance is going to get way harder, no matter how athletic you are. And then head moving with your eyes closed. Again, the difference should be relatively similar. There'll be a bit worse when you close your eyes. But if it's wildly different, again, this is a sign we want to train the vestibular system.